So let's start with talking about what are the common causes seen in today's time when we talk about infertility. And I present my first question to Dr. Abha Majumdar.
Hi, Mahima. I hope you can hear my voice clearly.
Yes, ma'am.
Yeah. See, when we talk about infertility, we have to understand that it is always not a disease which is underlying as the reason of infertility. So, broadly, we could say infertility could be because of male factors, it could be because of female factors, and then there is a subgroup which would be because of no factors which are known to us. They could be absolutely normal man in every respect and a normal woman in every respect, and yet they could present to us as infertility. So this is a very broad classification. Then we can go up to causes in the male, starting from problems in sexual contacts to semen deficiencies in every respect, whether it's count, motility, or the structure of the sperm. And in the woman, it could go either her tubes are affected and they cannot transport the egg from the ovary to the uterus. Either they are blocked or they are stuck somewhere so that they cannot function. And they can be stuck due to any pelvic disease, any pelvic pathology where there are adhesions, endometriosis. And then maybe she doesn't ovulate regularly or she just does not ovulate. And this also could be either reversible or irreversible. I mean, she could be made to ovulate with drugs, and there are cases where drugs will not work anymore. On the broad, I can only think of these many reasons. And if we go into nitty-gritties, we'll find many more reasons.
Thank you so much, ma'am. Yes. Now I would like to have my next panelist, Dr. Vandana. So, Dr. Vandana Hegde, ma'am, what do you think are the lifestyle changes linked with infertility in today's time? Ma'am, please unmute yourself.
Yeah, hi. Can you hear me?
Yes, we can.
Yeah. So putting across lifestyle, so there are two major components when we talk about lifestyle. One is the genetics that we are born with, and the other is the environment. So whenever we talk about lifestyle, we see people around the world now, lifestyle is changing for everybody. But we are seeing few people are getting pregnant, few people are facing difficulties in conceiving. So where do we draw the line? That means it is the susceptibility to the change. So some people probably are not able to cope up with the change, and that is probably the genetics and how the environment affects their genetics. So any exposure, whether it is the lifestyle, when you talk about sleep, for instance, some people can just sleep 2 hours, 4 hours like a Prime Minister Modi and then still function the whole day. But some individuals do want 8 hours sleep to be normal. So that depends on each individual's adaptability. When you talk about stress, some people can work in the most stressful environment and still be very healthy actually. So what actually drives this is basically probably the genetics and the susceptibility. So whenever you have an environmental change happening, I think it depends upon at what stage of their body the change is happening, what dose of the exposure they've had, for how long that exposure has been, and how best they can modulate it. See, the lifestyle, I think we cannot change because this is a fast moving world that we are in. But I think we need to identify today collectively and identify a few important things which has changed the scenario today, because what we as fertility specialists have realized that yes, infertility is increasing, and to come to it in both female and in fact even the male factors are increasing very drastically. Looking at the number of cycles that we're doing and the reasons that we're doing, male factor is also contributing to a lot of problems. So this is probably in this session we are going to come across so many changes in the environment and probably the genetics, which is a very good topic that we're taking out today.
Right. Thank you, ma'am. I would also like to ask Dr. Deepak Goenka now, sir. So if we talk about lifestyle changes and we look at the effect of modernization and Western culture in India, and especially if you look at the corporate sector, lots and lots of MNCs are opening up in India, and the corporate sector is taking over, whether it's male or female. a lot of people nowadays are, having alcohol issues and smoke issues. And if you look at the percentage of people who are into smoking regularly or having alcohol regularly, so according to you, what do you think the impact of this is on male or female infertility?
Dr. Mahima, I feel you are hitting the nail at the right place. These are very, very important topics which are affecting the fertility of the couple. We had some data 20 years back, the incidence of smoking among the male and among the female. And today we live in a denial stage. If females doesn't smoke, females alcoholism among the female is less or it is a taboo. No. There was a time we used to talk only the very lower middle class, the labor class used to take BDs, but no longer. Alcoholism and tobacco consumption, whether it is any class, it is rising. In one of the data 2 years back during the COVID time, it was shown that alcoholism and tobacco consumption among both the sexes, both the genders of the society in India, I am not talking about the Western country, is same. There is a drastic increase in the alcoholism and the tobacco consumption. The government is doing a lot regarding the tobacco consumption. Somehow alcoholism became a priority for the government also during the COVID time. We have seen everything else was lockdown, but alcohol shops were open the first. It was a source of revenue. That was very, very disheartening to see that. It is affecting the quality of the sperm. It is affecting the quality of the oocyte. These things are making a lot of difference, and we need a urgent measure to stop these things.
Dr. Mahima, can I add something?
Yes, ma'am, absolutely.
Ma'am, please. Ma'am, please.
Sure, you go ahead, Nisha.
I just wanted to add one thing, that not only the exposure, the starting point has also changed. Like, for example, in schools now, kids are exposed to. A few days back, in my daughter's school, she's in 11th, and they had a random check in the school for the bags and everything, and they found those e-cigarettes in the bags of many students. So it's not only earlier we were exposed to these things when kids were reaching colleges, but now they are exposed to these things because of internet, because of Instagram and all that. They are exposed to these things, and they are available in schools as low as high school. Ma'am, please go.
I have just one thing to comment, that I think late marriages or postponing childbirth is the biggest problem which is coming to us for IVF today. And they just go on postponing having a childbirth by the time the ovarian reserve is gone, or they have developed diseases like endometriosis has advanced, or if they had a small fibroid that has grown out of proportion. So according to me, it's not only late marriage, it is also marriage at the right time, but postponing a child. My own children postponed it till they developed fibroids, which I had to remove before they could get pregnant. I mean, they just said 5 years we need to take to know each other. So these are very important problems in my mind, that what is happening to the newer generation, which we are talking about. However, the villages are still not susceptible to these changes, and so they don't need IVF for aging related causes. It is mostly the urban population who comes up with this, and including what Nisha said, smoking, early smoking, it's lifestyle, it's fashion, it's Insta picture or whatever they want to post, looking at their parents doing the same.
Just continuing what Ma'am is saying, just sharing my experience. I started my practice in year 2000. At that time, the age group, the patients who used to come to our clinic used to be somewhere between 26 to 28. Today, majority of the patients which comes to our clinic is between 34 to 36.
35 to 40. Girls are getting married at 40, and then at 41 they arrive that
all
they
of
want
us
to
seeing
the
a
child.
visible transition among our patients age group itself. Jindal sir, you have to
but one thing,
unmute.
sir.
Yes, please go ahead. I'll speak after you.
No, one thing what I am getting a lot of patients coming is with early thelarche, early puberty. So we are now still dealing with this infertility population. But there is a younger generation which is probably changing faster to this reproductive endocrinology. You know, there is definitely something happening there. We need to address because I think infertility is what the next generation is getting ready for. It's going to probably shoot up a lot.
Yeah. That also, Dr. Vandana, is because of the early exposure to all these things. Like nowadays, even a 6-7-year-old knows on Instagram that what is menstruation, how, like, you know, they have exposed to all those. I don't know if it's right or not, but the material is available at the click of finger.
Very importantly,
maybe this is a good change, Nisha. Maybe this is a good change that girls are aware of menstruation. They don't hide it in their families. They know how to handle it. I mean, whatever age they get it. I think it's a welcome change that girls know about menstruation before they start menstruating.
A few lifestyle changes which are very pertinent and very simple, which have happened in the last couple of years in men, as well as the boys and the girls. One of them is weight. Second is the quality of the food. Weight has increased. Now, the basic weight of most of the people, especially in the urban population, has increased. And this weight is a major factor. Number two, the type of food you eat. Food which was eaten earlier was basically fiber diets with very little trans fats. Now most of the
homemade food, that was homemade food. Now it is
homemade food. So I always tell the patient that in case you need to change your diet, आप ये सोचिए कि आपकी दादी क्या खाती थी और आप वो खाना खाना शुरू करिए. 3. Sleep. 7 to 8 hours of sleep is very, very important for the hormonal levels to be okay, for the cortisol to be okay, for the testosterone level to be okay. 4th, just like was mentioned about alcohol and smoking. I mean, alcohol and smoking has become a lifestyle, I would say, issue. I mean, no party without alcohol is a good party. And if you are smoking now has decreased, but that has been in most of the populations, especially the semi-urban populations and like in the city in which I am.
Smoking has reduced, but alcoholism is increased.
Eating gutka and tobacco has increased. So what happens is कि पिताजी के सामने आप सिगरेट तो नहीं पीते, पर आप फादर से कह सकते हैं कि 2 दाने पान मसाले और गुटखे का मुझे भी दे दीजिए. And acceptability, the way it is in people. The 5th important thing which has happened is pollution. Very severe river pollution, groundwater pollution, chemical pollution, and pollution even in the environment as say air pollution has increased the level of oxidation, not only in the male gametes, but also in the female gametes. If you look at the population which has polycystic ovarian disease now, in which, if you ask me very honestly, the oxidation level in the ovaries around the follicular fluid for these eggs is much more. It is all affected by the lifestyle. In fact, I was reading this beautiful literature, and I was reading this beautiful literature on ashwagandha. And why was I reading it? I'll also tell you that. Because so many patients would come to me and ask me about ashwagandha. And I always, till the last 3 years, used to think, khana hai to khao, nahi khana mat khao. I don't know anything about it. I'm not interested. But when I went through literature and I found out that this particular herb, which has been eaten for so many years, 3,000 years till now, is actually magical. That's when I made this video on my YouTube channel, which has become viral. I think in the last 2 months, is about 3 lakh people have watched it. And I started eating ashwagandha myself after procuring those roots. So food, lifestyle, something which you can take as a healthy diet, food with fiber, jaw, bajra, homemade food, like Dr. Abha said. Let me be honest, how many people want to eat homemade food now among the young population? But in the villages also infertility is increasing. And it is increasing mainly because of pollution and the quality of food they are able to get.
So, sir, two important points that you've mentioned here, which is going to, make me ask my next question here, is that what about these protein supplements? A lot of men these days want to get into bodybuilding, are going into regular gymming, and are compelled to take protein supplements because their coaches are telling them to take protein supplements to boost up their body. What is the impact of these protein supplements on male fertility?
It's a beautiful question, because most of these protein supplements are, I would say, laced with testosterone. And most of them are not good quality. I mean, the packing is beautiful. They have every kind of beautiful muscles on them. So when these are laced with testosterone, and in a lot of gyms, in fact, I wrote 2 articles on this, in a lot of gyms, it's a routine to have gym weeks, steroid weeks. I visited 3 gyms and I asked people. So what they do is they have a week of steroids where there is somebody who coaches them on how to take all these nandrolone acetates with proteins. Now, these extra testosterones which are taken, they knock off the testosterone which is made by the body, and in turn lead to low sperm count, impotence, and every kind of problem. So protein supplements is a big no for anybody. And I think it's a very pertinent question which you've asked. And for whoever are watching this, मैं हमेशा कहता हूँ कि शरीर इतना तगड़ा और स्पर्म इतना कमजोर. आपको याद होगा एक फॉरेंस का ऐड आया करता था बहुत पहले, मैडम ने सुना होगा, फॉरेंस का ऐड होता था कि शरीर इतना तगड़ा और दांत इतने कमजोर. In fact, that's just the way it is. When somebody walks into the clinic who is well built, massively built, लेकिन उसका चेहरा उतरा हुआ है, तो 2 मिनट में समझ में आ जाता है कि ताकत कहीं और है और कहानी कुछ और है. So this is what exactly happens with these men.
Right. Thank you, sir. My next question for Dr. Lakshmi. So, ma'am, since sir was also mentioning about that infertility exists in the rural sector as well. So what do you think would be the major difference in the causes between the urban sector infertility and the rural sector infertility?
And slowly, even the rural sector is taking the flavor of the urban sector. They are changing their lifestyles. They also have these joints where they get their curries from. Added to all this, from the urban sector, I think it's the pesticides. Excess pesticide use in the rural sector by the farmers. Most of the patients who come from the rural background, they are mostly farmers, and they tend to do farming, and they are exposed to these pesticides. So this is one of the causes for male infertility or female infertility. For that matter, if we do IVF in these patients, the quality of the sperm or the egg is quite low when compared to the urban population. Most likely, though we don't have much studies about this, but it could be because of the pesticide, high pesticide use, and also, as sir told, it could be because of the population pollution, air pollution, and also the water pollution that happens in the rural and urban areas as well. And when you look at the urban population, we should also talk about the selective estrogen receptor modulators that we see, or that we are exposed to day in and day out, starting from the aftershave that the male uses, or the perfume we use, or the the makeup we use. All of these have some of these components that might affect our hormones. Our hormone modulation will be done by all these agents. And because day in and day out we are using all this could also be one of the important causes, like how Dr. Vandana was talking about premature tilarchy, premature menarche. These are also one of the factors that are causing all these problems. And also they increase the risk of PCOS, increase the risk of endometriosis in women, and reduce the sperm count in the males. So we have to look at, while looking at the lifestyle, I think we have to look at these parameters also. We have to educate our patients, our youngsters also, about the effect of all these on the on the health of themselves.
Right.
Dr. Mahima, may I just add one more point here?
Yes,
As
sir.
everybody was talking about the early menarche, Dr. Lakshmi was also talking, Vandana ma'am was also talking, Dr. Nisha was also talking about the early menarche. Lately, it has been studied and found that post-COVID or during COVID, lot of young girls are getting early menarche. And one of the reasons which was found is sanitizers, hand sanitizers. We are using nowadays hand sanitizers left and right every time. We are encouraging hand sanitizer, yes, definitely. But we must also remember that these hand sanitizers consist of triclosan. There is a chemical called triclosan, which results into early menarche in female as well as gynecomastia in male. So these are also some new factors which are coming up after this COVID.
Interesting. So, since we've been talking about lifestyle changes and lifestyle modifications that is needed in today's time for people to take care of their fertility, related to lifestyle, one more question I would like to ask. This question is for Dr. Nisha Bhatnagar. So, ma'am, my question to you is that if we look at today's lifestyle, especially the food habits, or if we look at the sunlight exposure habits, a lot of people in today's time have vitamin deficiencies. If we talk about the deficiencies of these nutritional elements in the body, till what an extent are the deficiencies responsible to leading towards, I would say, maybe reversible infertility?
That's a very right question, because if we talk about vitamin D, if you remember, when I was in 12th or something, there were times when during winter, everybody, almost all the houses, they used to sit on the roof with the sun exposure, eating all those carrots and mooli, namak lagake, and moongfali. Everybody used to do that. Nowadays, everybody comes out of the house, sits in the car, goes to the place, comes out of the car, and then goes back and sits in the car. And during that exposure also, we are using a lot of sunscreen on our skin. So definitely sun exposure is not there. We were supposed to be lucky that because of our skin, because of our melatonin, we were the good ones. We had a lot of sun exposure. But now if I'm checking vitamin D levels in the couples visiting us, 99% of them have low values. 99% of them, almost everybody. So this is one thing. Second thing is, as you rightly said about the food, also if we talk about our past, like 15-20 years back, there were hardly a time when we used to go out and eat the outside food. Our food was balanced. There were spices, there were dal, there was turmeric, everything else was there in the food made at home. So now there is, at the tip of the finger, the ma'am said that it is correct for for the information and everything. But even if we had to go out, we used to take permission from the parents or something. Nowadays, you don't even know how many times the food is ordered at your home, sitting at home, it is delivered at the tip of the finger, at a click of the finger, and the children are eating that. So this is science's literature has proven beyond doubt that vitamin D deficiency is associated with infertility. So if we want to correct that, I think we need to start right from the very basics, from the childhood. Though the information is there, teachers are teaching, teachers are telling the value of the food, nutrition. Yes, ma'am, please. Ma'am, please go ahead.
Yeah, I feel that yes, vitamin deficiency is very important, and iron deficiency known to be in rural areas because because of the financial status, they may not be having access to enough iron. But labeling a certain vitamin like vitamin D, there are controversial studies and evidence which comes out. So if a patient is thought that just correcting vitamin D levels is going to lead to fertility, or because vitamin D was not corrected, that is why the IVF cycle failed, this myth has to be taken out from their heads that yes, it's important, and it is more important when we are looking at pregnancy status, because in pregnancy, adequate vitamin D will lead to a good supply of calcium to the baby also. But before pregnancy and infertility, yes, all deficiencies could contribute to ill health, true, but it will affect the pregnancy more than an infertile woman or man. So we have to remember that. So take home message should not be that vitamin D agar kam hai, so don't take them for IVF, don't give them any treatment till you replenish it.
No.
Replenish it, correct. If iron is low, hemoglobin is low, replenish it. For hemoglobin, I would say till she doesn't reach 9 or 10 grams, don't start infertility treatment. But for vitamin D, I wouldn't say that.
Ma'am, it is important to substitute. The replenishment is so easy nowadays. There was a time we used to test.
We are talking about lifestyle corrections here.
Yes.
What Nisha said is very good, that, lifestyle has to be changed, that we need to get exposed to some sunlight somewhere.
Very
The
important.
Caucasians go and sit on the sea beach or any park and they expose themselves to sunlight. We don't do this because we may become more dark. We don't want to become dark. We don't like dark skin. But I think we need to expose ourselves also to sunlight like we did it in our early days.
Our past.
It's also important when we expose ourselves, isn't it, ma'am? Like it should be between 10 o'clock and 3 o'clock. That's when we get most of our vitamin D synthesized from our body. So most of the experts say that it should be between 10 and 3, not like in the morning, early in the morning. Most of us, if at all we get exposed, it will be early in the morning, between 6 and 8, where the synthesis of vitamin D will be very less. So definitely we should be exposed, but it should be between 10 and 3, and the maximum exposure shouldn't be there beyond the redness that develops on the skin. That is also important, because sometimes we think, okay, the longer we sit, that better it is, but it might not be good for the skin also. So that precaution also should be taken.
Absolutely. I think these are some great tips shared by all of you. Now let's talk about how we can reduce the burden of infertility in the society in India. So I would like to start with Dr. Abha Majumdar, ma'am. How do you think we can reduce the burden of infertility in the society in India?
We will have to start from the grassroots level and then move forward. If we talk about IVF or infertility treatment can reduce the burden of infertility, that will not work. So we have to improve everything when we talk about personal health and environmental health. And apart from that, genetics we cannot change. Yesterday I was in a chromosome microdeletion, can now have a child and a boy will have the same problem. But then how did Y chromosome microdeletion come into our blood? It came through mutational genetic changes, which will continue to happen. So if we want to change, we cannot change our genetics. Right from the time our child is born, we have to stop overeating, we have to stop overfeeding, we have to stop junk. Homemade is a must. Early to rise and early to bed was a dictum, which doesn't work in today's world because everyone is working online late hours. But yes, sexual contacts are so infrequent in infertile couples who attend my clinic. So we have to make, and then if they have it, they only have it on targeted days, which again makes the man go through a lot of stress to have a sexual contact. I'm jumping from one topic to the other, but it is such a vast topic that what can we do to improve? We can't change genetics, but we can change our lifestyle right from birth till this age by reducing junk, having more food, and by adding some physical exercise so that we can keep our weight almost normal, if not normal BMIs or normal weights. And apart from that, late marriages, if there is a late marriage, try early for a pregnancy. Don't postpone pregnancy to more than 35 years. If you get married at 35, please just look at the initial factors, the male factor 1 ultrasound to see that all looks normal. And if all looks normal, then maybe you can postpone according to your professional priorities. But if there is a problem which you see, 3 is work is important. But if you're living together and you want a child, then it is important to be sexually active. This is the biggest problem I see because about their sexual activity, and the answer I get from 90% of couples is, oh, we know the fertile period and we only have can you hear me?
Yes, we can.
You can. Because Mahima has become still. I think her internet must be a little defective. So I feel that, frequent non-targeted sexual contacts are very important. Targeted sexual contacts impose a lot of stress to the male.
खाली मेरे को सुनाई नहीं, मैम फ्री हो गई है.
Yeah, I think it's ma'am's internet.
Yeah.
I want to add one more thing to this.
Yes.
But ma'am said correct. It's absolutely correct. But I just want to add another thing here is that again I think again the exposure to each other. Like earlier, whatever was happening was that after marriage it was happening. But now all those premarital sex and everything, people don't have an element of mystery. Everything is available on the internet. You can go through it. Then people they are not interested in, usually even if it's a love marriage, they have been together since years. So it's, there is that element of mystery is not there. They don't want to explore each other. It's like, you know, they have been together since years. So the only time left is to have intercourse when you want to have a child. So this is another factor which has changed over the period of years, and maybe that is contributing to the infertility problem.
Yes,
Mahima,
ma'am, you're back.
Mahima,
In fact,
with your
Yes,
permission, may
Yes,
I ask a simple question to all the senior esteemed faculty?
yes, sir.
Abha ma'am is there, Jindal sir is there. Relevant to your question only regarding the prevention of infertility and late marriages, as ma'am was talking. How many of you feel there is a role of oocyte cryopreservation, selective oocyte cryopreservation in the prevention of infertility? Lately, we are getting a lot of patients, lot of girls, unmarried girls, coming to us for the oocyte cryopreservation. It will be very interesting to understand the opinion of seniors here. Role of oocyte cryopreservation among the unmarried girls in the prevention of infertility.
You know, let me tell you, we must have cryopreserved more than 100 for 100 girls who cite. Maybe one has used them only. Rest of the girls, I don't know, they are waiting for what? They are waiting for the right time, right partner. So for social reasons, if you preserve, then the girl has to be very clear that she will come back to use. And one of my girls who preserved her oocytes became pregnant naturally. So all her oocytes are lying with us, and she got a partner at 40, 41. And she conceived. So there is a role, but how much is it going to be useful in future, we really don't know. At the present moment, over the last 10 years, we have preserved a lot of oocytes. They are all with us, bearing for 2 or 3 girls.
Yes, Dr. Lakshmi. Yes, ma'am.
Yeah, ma'am, that is a very valid point. You know, but many a times, what I have seen in my practice is many women come like at the age of 38 or 40. The ovarian reserve has gone down significantly. So one important point I want to mention here as a platform is that whenever they want to preserve, when they don't have a partner, it's better to preserve the oocytes early than later. You know,
that is very correct.
It feels very sad to see these women coming up saying we didn't get a partner yet. We want to preserve our oocytes, but by the time they have lost everything, whatever could be preserved earlier on. So I would feel that, you know, this platform should be used to inform all the women who wants to preserve their fertility that the earlier the better. Maybe around the age of 25, 26 or 28. If they come
or Lakshmi, maybe by the age of 35. Nobody thinks at 25 at preserving.
Yeah, ज़्यादा जल्दी हो गया वो थोड़ा सा.
But 35, 36 is the right age, not
Madam,
40.
35, 36 in our Indian scenario, you know, the ovarian
It's already low. It's already
it's already they have missed the boat. So what I feel is at least they should start thinking about it. And at least they should start thinking about it, and they should look at their ovarian reserve. Even if they are not thinking of preserving, they should at least get an idea about how their ovarian reserve is and how they should plan their future, especially if they want to have a family and they want to have kids. They shouldn't come to fertility preservation at 38 or 40. That is an important message I want to.
I personally think, you know, it's very true that oocyte cryopreservation, of course, is something which is very niche, in fact, very micro niche area. But apart from that, and it's a beautiful question which was asked by Dr. Deepak as far as this is concerned, but a lot of women need to be educated before they get an oocyte cryopreservation done. It's not that they come to you and you say, please go ahead with it. Age is a factor. When they would get married would be a factor. Would they really use it is a factor. But most these are factors which they have to be counseled about. But there is one very important thing which I think in the conversation we were having before oocyte cryopreservation came in was that people in their lifestyle as children need to be brought up. Dr. Abha was talking about it, how they should be brought up. Early to bed, early to rise, all those things are fine. But one thing which is important is sex education. Sex education is the primary thing which our country lacks. People do not have sex or only have sex at the time when they want to have a child. Normally, these men are overworked men of these corporates. Their testosterones are down, their cortisol is high. These are men who actually his libido is down. I have so many patients of this corporate sector in which the libido is absolutely down. You get their testosterone done, it is low. Cortisol is high. They sleep at the wrong time. Alcohol is rampant. Smoking is. Sexual affairs are present. They've been treated for infections. All these things are present in them. So my personal submission or thinking is that during classes, school, sex education is most important. Unfortunately, most of the schools do not have sex education, and the education is on the basis of mobile content, which actually desensitizes human beings to the education which should take place. So my feeling is, apart from lifestyle, which is the weight, which is the food, which is alcohol, smoking, which apart from that is burdens of sexually transmitted diseases, good sex and sex education. These would form
Sunil,
a basis.
I would want to make
Yes, please, ma'am.
just one little thing. Sex education is important for both boys and girls.
Yes,
but
both
for
of them.
girls, it is more important because of but for boys, what is important is masturbation is not unhealthy. Discharging while they sleep is not unhealthy. Having sex with a woman is not unhealthy. Wearing a condom doesn't make them less desirous of having sex. That myth of wearing, so many women come and tell me, my husband doesn't like to wear a condom, he's a diabetic and I always get this infection, whatever she has. So it has to be explained to them that you have to just try it a couple of times and you will get used to it, and you will protect your wife whenever you want to protect, like you said, from infections or diseases or anything. So this education is important, but the youth today needs to be also educated. A lot of women come and they ask me, are we having sex from the right place? Can you examine me and tell me this? This is the extent of, I would say, not unawareness, but a lack of education in the youth. Some of them have this amount, they look so fashionable, they are so modern, and they don't even know whether they are having sex properly or not.
A patient came
to me.
So
all type of education is important. Growing up as a healthy individual is important. Having no vices is important, but then all these people do have children. So they are not absolutes. Whether they are smokers, alcoholics, they grow up badly, they have one targeted sex, everyone gets pregnant also.
I tell you why sex education is so important. The other day, sometime back, this patient came to my clinic and she was a young girl. She was about 24 and her husband was about 35. The husband had a second marriage, and she brought in the husband and she said, you've got to examine him. There is some problem with him and there's a major problem with him. So I asked him, what's the problem which you have? He said, I have no problem. I'm absolutely fine. Then she says that he takes very little time to discharge and it takes only 6 to 7 minutes to discharge. So I kept quiet and then I told her that the normal timing would be less than 5 minutes. What made you think that he's got to last longer? She kept quiet for a minute and she said, no, you are incorrect. Whatever I have seen on the internet is 10 minutes, 15 minutes. There is some problem with it. Now the problem, basically what has happened today is that sex education doesn't take place and the education is in the wrong fashion. And this also has become a major problem for fertility too. And this needs to be taken care of, and schools don't allow it. A lot of
you can't stop the Google search of all these people. Google has become our prime educator today, Sunil. So that will always stay with us.
No,
You want to have good food, you go to Google, you want to go somewhere.
No, but Google is great because the YouTube is great to give sex education. I've made these videos which are fantastic and seen by so many. I'm so happy. But the problem is pornographic literature, pornographic movies, which every child has an access to.
Which you cannot stop. Which you
cannot do anything.
Yeah.
You cannot, and therefore they need to get proper sex education. But what you're seeing over here is incorrect. These are all films. These are all edited films. Please, this is not the way it actually is. This is what education is.
Sunil sir, I will just share a small incident. I think few years back, educated couples in IT sector came to me. I was the second doctor, was referred to me. When I investigated, when I was taking the history, I did the investigation. Most of the investigations were done outside. And it was looking like an unexplained infertility. Everything was all right. And we were almost labeled them, yes, it is a case of unexplained infertility. While talking to them, suddenly they told, we don't really understand why we are not conceiving. We are having sex at the right time. He is discharging at the right place. And everything is all right. I said, what do you mean by right place? He was discharging on the umbilicus.
Oh my God.
So I just told them, please don't do that. Discharge inside and she conceived in the next month. So look at the ignorance among the educated couple also.
Absolutely.
So I think adding to this discussion, let's also talk a little bit about the genetics. So if a couple has had infertility, right, and they plan to have a baby through different infertility treatments, does it mean that there is a high risk of infertility in the children in future also? My question to Dr. Abha, ma'am.
See, we all understand that nowadays infertility, a lot of genetics is underlying infertility, and every day, every year, new genes are being discovered, and we are linking it with not just known disorders which are there today, like Turner's mosaic, Klinefelters and all, but even endometriosis, fibroid, PCOS, there are genes which are connected to these. So I wouldn't say genetic disorders are rising, but yes, the discovery of new genes is linking genetics to environment. Now, about passing of genes to the children. Now, suppose 40 years ago, Louis Brown was born. There was no IVF. Yet, we started discovering males with Y chromosome microdeletion. So they were born. How were they born? Either genetic mutation happened in them and therefore Y chromosome got a microdeleted segment, or the father was someone else. Whatever you may, interpret in those days. Now we have children who would be born out of these fathers, and that son would always carry a Y chromosome microdeletion, which would be of that extent or more severe. So when we treat people of known genetic disorders, then definitely that genetic disorder can be passed over to daughters or sons as disease or carrier status, which would again keep on passing. But then there is a other side of this coin also. IVF has advanced to a stage where if two thalassemic parents, minors, get together and make a child through IVF, we can screen out the carrier embryos, remove them, the diseased one, and remove them, and we can make them have a child with absolutely normal, non-thalassemic child, which in any case naturally also is 25% chance. And through IVF also we will pick up those 25% embryos which would be free of the disease. But we could eliminate a disease also by the use of ART. But genetic disorders will definitely be passed over to some extent, depending on whether it's a recessive gene or a dominant gene, whether it is sex-linked or autosomal linked. All this will decide whether the genetic disorder is going to pass over to the generation which is there. But then there are unknown genes also responsible for condition, and we know that PCOS mother has more likelihood of having a daughter which has PCOS. Mother has early menopause, again ovarian function will decline early for the daughter. Mother has endometriosis, the incidence is higher in family. So they have to be candidate genes responsible for these conditions. We need to find them. In near future, we will find them.
So I think a very valid point you've mentioned there, ma'am, because even a friend of mine, when she conceived, her the fetus was tested positive for muscular dystrophy, and hence she was told that in future, she needs to plan an IVF so that the genes can be selected and she can have a baby accordingly without muscular dystrophy. So I think IVF has a big role to play in such situations.
There are now so many diseases now. We can eliminate the disease from the family by selecting not a carrier embryo, but a disease-free embryo, especially in recessive conditions. Even in dominant conditions, we can do that.
Absolutely. I would like to present my next question to Dr. Nisha. So, Dr. Nisha, so in today's time, if we look at the prevalence of breast cancer, there are lots of young women also being, detected with breast cancer. And when they undergo the medical therapy for the treatment of breast cancer, there are studies that show that it can affect the fertility of the woman as well. So in that aspect, I would like to ask you the impact of such situation on fertility in women in India, especially considering women in their 20s and 30s who are suffering from breast cancer and are going through the awareness without having the knowledge of preserving their eggs before that.
I think the onus lies on the specialist. They should counsel them for going for at least their egg preservation. And nowadays we have come with such beautiful protocols that we don't have to keep waiting for the periods to come, or we don't have to, prolong this cycle. It can be done as early as within 2 weeks. There are random start protocols. We don't delay the treatment of the patient. We ask the patient to go for stimulation, and then we preserve the eggs. And then second thing, most of the breast cancer are like estrogen dependent, tumors. So we have protocols where we can use drugs in a way that they don't reach high estrogen levels in the body. So fertility preservation is a must for these females. It should be counseled. They should be presented with the choice at least when they are diagnosed, and they should be given the option of freezing their eggs before going for any treatment, because this is without a doubt that the chemotherapy and the radiotherapy and even the surgery, all that affects their fertility later on.
Absolutely. Dr. Vandana, would you like to add something to it?
See, what I feel about genetics, genetics, what we tell that it cannot be changed. There are two important things that happen when the environment is speaking to the body. So one is, endocrine disruptors. So this is a very important because today it is an part of our life. See, what we see, we can avoid. What we smell, we can avoid. But it is, I think, ubiquitously present all over our body. We are living in a hyper-estrogenic environment. When Dr. Sunil told about all the pollution that is happening, whether it is through the industrialization, through all the vehicles that we are using, the river pollution. So basically, the entire environment is filled with gases, and these gases are all estrogenic gases. Now, the male body, when it is there in an estrogenic environment, it undergoes genetic changes. This is called as epigenetics. So when the environment acts with the genes. So this epigenetics is nothing but, see, genes is what, it's like an on and off switch. Like you have a gene control for everything in your body, and the body functions. But how it should function, that regulation happens through the environment. So these are called as small mutations. These mutations then get transmitted to the other generation. Now, what happens when a lady is pregnant is, she is pregnant, so she has a baby within her, and the baby again has its own ovaries within it. So that is the reason they tell that whenever there is a pollution or an environmental effect, it affects 3 generations. It is not just that lady alone. It affects the baby and the next generation of eggs that are going to come out of that baby's ovaries also. So it's very important, because what they noticed when they used the DDT, which is almost removed today from the pesticides. But what they've seen is the soil is remaining contaminated for nearly 100 years after it has been used. So it's a very extensive damage that environment is doing. And we, I think, should bring out a very big change if we have to break this connection, because environment is definitely interacting. Regarding endocrine disruptors, yes, again, it is there in every part of our life, because see, it is there in the pesticides that was already mentioned, because it is coming through our food chain. And what happens in the food chain is there is something called bioaccumulation. That means every time it goes from one part of the food chain to the other, the concentration of these pollutions go on increasing. I mean, it increases in very high multiples. It is not just a small increase. So by the time it reaches the human, we are on the top of the food chain, today. So we are having an accumulated effect of all these contaminants there all around us. So these endocrine disruptors, actually, they affect the way hormones function in the body, whether it is in testosterone or even the pituitary hormone, which gets
I think she's having internet issues.
Cancer are almost, I think, going on hand in hand. So probably these are the things that we should look at. Probably go more organic. The food that you eat should be probably more organic. Yeah. That we are using in our the washing clothes do contain a lot of pollutants. What we are using in our day-to-day life we are surrounded by pollution. So that is something that we should look at how to avoid. Because regarding mobiles now, whether radiation exposure, these are all ionizing radiations. So the use of microwave in our life, the mobiles in our life, how safe are we from all these? I think there are a lot of, and it's very difficult to do research in these areas because you have got a lot of confounding factors. So to come to any final conclusion, it's going to be very difficult. But I think we should become more sensitive to the environment around us, and it should be a collective effort. One individual change. I think we as the humanity has to come across together to change the environment around us. Otherwise, fertility problems is going to take a major issues, especially with epigenetics. We are seeing a lot of DNA fragmentation index, which is definitely increasing in men, and this is definitely related to the genetics. It is not just about the environment or the lifestyle. There are genetic changes happening, which is becoming transgenerational transmission. So I think we should definitely be very.
So I think on that note, I would like to thank Dr.